as we put out in our piece, and I think it's on the website right now, you know, the people in the political parties, they adhere to the adage that is, if you are setting the agenda and the other parties are reacting, responding to your agenda, you're winning. And so everybody's trying to get out the chute and get it out there first. You know, that gets further, I guess, more complicated when there's this traditional liberal NDP dynamic that, you know, the NDP will float out a number of ideas and the Liberals generally will say, well, that sounds good, we'll do that. And then the NDP go back to people and say, well, that was our idea, we said it first. So we saw this last year with the pharmacare. You remember in April of 2017, the government announced free drug coverage for everybody who's under 25 years of age. And I think 2 or 3 days before that, the NDP announced that they had a pharmacare plan, which was a little different. At the end of the day, with all due respect to our friends in the political parties, I don't think anybody remembers or anybody cares who came out with it first or who came out with it second. The fact is today, if you're under 25 years of age, you get your prescriptions covered. And we're going to talk more about pharmacare in just a second. So Abid, in the normally predictable and staid world of Ontario politics, there's a lot to talk about here.
Oh, absolutely, especially with respect to healthcare. This week was very much Health Week in Ontario, with respect to the Premier Wynne making a flurry of announcements on a daily basis the entire week.
Yeah, well, let's get into those. And I just wanted, for those of you who may not know Abid or know of him, we do a lot of healthcare work here at Sussex, and Abid is, that's what Abid does. He works on healthcare files for our clients, and Abid's been in and around the Ontario Ministry of Health since 2003. So if you're wondering how we go about selecting who's going to be on this program every week, this week clearly was predominantly about healthcare, so it made a lot of sense to us to have one of our healthcare subject matter experts appear and talk about the events of the week. So we had a throne speech on Monday, and the throne speech largely, for those of you who don't know, it's a signal of intention. It's a directional document. It's read by the Lieutenant Governor here in Ontario. If it were in Ottawa, it would be the Governor General. It's written by the Prime Minister, in this case the Premier and her people, who say, in this session of Parliament, here's what we're going to do, here are the priorities that are important to us and to people, and in what is left will be a very short session, I guess, probably till the end of April, first couple of days of May. Right. Here's what we intend to do. Now, for those of you that have matters, and I know because we work on them, the government also signaled that any government bills that were on the order paper when the legislature was prorogued will be reintroduced. And in fact, this week they have been reintroducing them. So if you were concerned, the numbers will have changed. If you were concerned about Bill 203 before, now it's Bill 3. But if you're not sure, then contact your Sussex consultant and we can bring you up to date about where things are at on the legislative agenda. So we want to put that out there. So we had a throne speech, and at a high level, these are the highlights. The government said the priorities would be reducing wait times for healthcare by significantly increasing hospital operating budgets. And Abid, I'm going to ask you to comment on all of these because these priorities were articulated on Monday. It's Friday, and in the time in between, there's been a flurry of announcements that Abid's going to bring you all up to date on in just a second. So second priority, expanding home care to provide more services for seniors choosing to stay at home and to provide financial relief for families who are caring for aging loved ones. Next, making historic investments in mental health and addiction services so people of all ages can get the care that they need. Additionally, ensuring more people without a drug and dental benefits plan will have access to more affordable prescription drugs and dental care. Providing more college and university students with free tuition through the new OSAP. Making investments to train more apprentices, focusing on regions that are struggling to achieve economic growth, and continuing to make investments in public infrastructure such as schools, hospitals, roads, bridges, and transit systems. So Abid, these are the priorities that the government's articulated in their throne speech. Normally, in the normal course of events, the throne speech would have put those things out there at a high level. We would have waited until the budget is tabled, which is next Wednesday, March the 28th. Right. And these announcements would have then been put out there with numbers attached to them, details, geography, costing, etc. This time, the government, I think in an effort to draw as much attention to these things as possible, did the throne speech on Monday, and then Tuesday, Wednesday, Thursday, and today have just gone on a tear of announcements. So let's start with the one on Tuesday, which is important to us. Full disclosure, we work for the Ontario Pharmacists Association, and on Tuesday morning, the Premier, the Minister of Health, and the Minister for Seniors made a fairly significant announcement in the area of drug coverage.
Oh, absolutely. This was about expanding OHIP Plus. The current concept, there are many different drug programs that currently exist within Ontario. There's the Trillium Drug Program, there's the program for seniors, those over the age of 65, who receive drug coverage for 4,400 drugs, but they have to pay a copay per prescription and a $100, and those with higher incomes, a $100 deductible.
Which is an annual, they pay it once a year.
Once a year, that's right. And then there's those who are on social assistance. And then there's OHIP Plus, which is a different model, whereby, yes, they are covered for those 4,400 drugs, and for those who are under the age of 25, but they don't have to pay a copay when they go to the
so it's completely free.
Completely free. So this notion of free is a concept that I think, generally speaking, is popular with Ontarians. Anything that help reduce healthcare cost, reduce monthly costs, is something that, and to make life affordable, is something that I think Ontarians want to see, and I think government, in this case the Liberal Party from a political perspective, is trying to achieve as well. So the idea is to extend that model to seniors, those who are over the age of 65. Currently in Ontario, those who are over 65 pay a copay of $2 if they're lower income, or if they're higher income, that is those who are approximately over the income level of $30,000 a year, pay a $6.11 copay for every drug that they receive. And they also have to pay on August 1st of every year the first $100 of their medication costs.
That's the deductible.
That's the $100 deductible. So all that goes away, and the government estimates that seniors will save on average about $250 each per person. Again, comes back to this notion of affordability, increased access. There has been concern in those in drug policy that people were not taking their medications on time. They were not adhering to their medication regimen because of the issue of cost. And I think that part of what they were trying to do from a policy perspective was to increase that adherence, reduce barriers to medications, and hopefully keeping any complications, keeping seniors from any complications that might occur as a result of not adhering to a medication regimen.
Okay, and we actually were there when this announcement was made. We were in the audience, and the Minister of Health indicated that the total cost to the Treasury of this program is about $575 million.
Right.
So the deductible goes, and I guess the pharmacy, rather than asking the senior for the copay, will receive it from the government. It's no secret that some pharmacies, in an effort to help people out, remember, if you're a senior on multiple medications, you're in the pharmacy a lot. Mm-hmm. And $2 at a time, $6.11 at a time, it adds up. So a lot of the pharmacies were waiving the $2 copay in creating financial stresses for themselves in order to help people out, and now they'll be made whole from the